So my name's Amanda Thornton. I'm the Digital Health Clinical Lead for Healthier Lancashire and South Cumbria. And we have to recognise the popularity of this event and how that is a signal for us about people's readiness and eagerness to think about digital and adopting a digital for the good of our patients, our populations and our services. Brilliant. So I've got the housekeeping. We're in this room for most of the day, and I'd rather have you here than not, but it's a little bit of a tight squeeze. We've also got 2 breakout rooms for this afternoon, but this is the main area that we'll use. Toilets are just through that door there. It's an open Wi-Fi, just look for Farrington Guest. We are using a hashtag today, HLSC Digital, and you can go to our website as well. And on this website will be the digital strategy as it launches later on in the day. And we're live streaming, and we've got a parallel workshop going on, parallel conference going on. We've written out to lots of patient participation groups across the patch. So we might be getting questions through this hashtag as we move through the day. So welcome to all those people that are with us virtually on the live feed. And we want you to share your questions, share your thoughts during the day, if you please. We're also mindful that we're in a very special year, and we are doing a great job of celebrating that fact across Lancashire and South Cumbria. We want to capture stories, if you're brave enough, and we have got some cake as a bit of a reward, if you do. We've got somebody over there, Andy Downton, who's more than happy to capture your memories, your stories of the NHS. And also, because we're at a digital event, if you want to share your passion for digital and what it makes a difference in your daily life, please tell us those stories too. So we will soon hand over to Amanda Doyle, who will formally launch the refreshed Healthier Lancashire and South Cumbria strategy. The morning will see us hearing about the asks and the opportunities. National leads will share the maturing plans, and then we will respond in terms of what that means for us for Lancashire and South Cumbria. We are keen to stay on time, and when we do, that will mean that you've got the potential to ask questions of the speakers while they're still up here. Starting just before lunch are the workshops, and we've got 4 workshops that will just show you a little bit of the passion and the ideas that we've got for how we plan to do things differently to support and encourage innovation and digital adoption across our patch. We will close the daytime event with a question and answer session, making the most and reflecting on the day. And for some of you, it's great that you can stay for the evening session, and we'll have other people joining us. And that is a well-earned moment to stop and applaud the fabulous progress we have made in enabling a shared care record to help clinicians, practitioners and other care providers see all the relevant information they need at the point of care to make the best quality and the safest decisions. Set to be a fantastic day. Going to hand over to my colleague and peer here, Declan, who will just set the scene.
Thank you very much, Amanda. Amanda's told me to be very strict with time, and some of you will know how bossy she is, and it's just not worth upsetting her at this time of the day, because it's only going to get worse. So my opening bit today was to talk about the previous digital strategy and compare and contrast. I've been told I'm not allowed to talk about the strategy itself, the content, so I'll try and stick to that brief. The previous strategy for Lancashire and South Cumbria, or the digital roadmap for Lancashire as it was at that time, was about 80-odd pages for those of you who took the time to read it. It was a great idea about bringing us all together. Unfortunately, typical to the NHS, what did we do? We put a load of templates and things in there, so it wasn't really something that people could digest. Now, I can't see him in the room. As I had a problem yesterday with my eyesight. Is Matt in the room here? Matt Simpson. So Matt told me something earlier this week that makes me realise that we needed to change the strategy. And I hope I get this right, Matt. So for those of you who are familiar with patient activation measures and patient empowerment, and what the patient measurement tool does is measure people's readiness for change and readiness to take control of their health. And apparently it's a score of 1 to 100. And for every point you can move a patient up that scale, there's a correlation that they'll use health services 2% less. So one of the biggest gains we can get in the system, we can transform and do all the wonderful things that we do, but actually if we can get people to do more for themselves, take more responsibility for their health and well-being, that will be the biggest gain we could achieve as a health system. Is that right, Matt? Right, yeah. So without further ado, I will introduce you to Dr. Amanda Doyle, who's our Chief Accountable Officer for Healthier Lancashire and South Cumbria.